I have been talking about my experiences and what is medicine. Now, I ask a simple direct question: is medicine an art or science? So we see certain scientific facts, but medicine, you have got certain scientific facts. That is, you have got certain physical sciences. Physics, today we have landed on the moon. There is something to guide. There is speed of light. There is velocity, and that is in physics. The speed with which it will go, speed with which light will travel, speed with which sound will travel, the speed with which the opposing article will oppose this, and what is the momentum, what is the velocity, what is the gravity, everything is measured. Physical sciences, you have got a measurement. Mathematics also is an exact science. Today, if the lander is able to land there, and it is able to, we are able to travel to any place, not only lander, our car, anything, you can close your eyes and you can travel, you can sense it, you can get a measurement. All these things are possible because of the advances in science. You can measure velocity, you can measure valency, So this is in physics. In chemistry, how the elements can react with each other, what is a product, and from the products what are the things are, and what is the combining power, all these things. Similarly, in geography, you can say length, breadth, height, etc. So the physical sciences can more or less be measured. But when to come to biological sciences like botany, zoology, chemistry, we have the outline of the study. But the living objects, when it comes to human being, he is also classed as in the zoology, the animal kingdom, he has the advanced kingdom. Say there, certain things can be measured, certain things can be done only with the experience. So when we say science, it is not an exact science. Medicine is an inexact science. We pool experience. Medicine is a science of probability, not a science of certainty. People confuse things. They want exact result. 2 plus 2 is going to be true in mathematics. 2 plus 2 is not 4 in medicine, because we test the drugs. The drugs were not mostly derived from animal kingdom or plant kingdom. They were used with the experience by the native people. Then they were taken up by the allopathic medicine. Then they were tested. The active ingredients are graduated and then taken for animal test, in vitro test, voluntary test, and then they are used in human beings. After undergoing the series of tests, these drugs are used. So the drugs are used with a very great effect. Even then you cannot say the particular drug will be effective. There may be individual idiosyncrasies, or the drug itself may not be active. You cannot say chloroquine is good against malaria in all the cases. It may cure 99% but not 7%. And typhoid and chloromazine is not the end or cure for all cases of typhoid. It may or may not. So for everything you have to tell it with a little grain. So you want to study the book and you want to arrive at a diagnosis and you want to question the doctor. That is, in other words, you want to become a Google doctor. It is not practicable, because we study, we are taught by people who are experienced for centuries in this field. We read the books by others, we experience ourselves, and we have tested all these patients. When I see a patient, all these previous patients appear before my mind, and when I touch a patient, all these they come to my finger. With that experience, I touch the patient, I say there is perforation or not. This experience you cannot have. This experience a junior cannot have. This experience, similarly, when auscultation, when a physician does auscultate, the experience is entirely different. So we have to say, you cannot, it is an art. It is an art combined with the science, with the years of experience. So you can never assure that a particular patient will be all right. The simplest of the operations I have lost. The most complicated operations the patients have lived. It is not my hand. It is not the patient's fate. It is something. See, the patient is a living being. you do not know how the tissues are going to react, and you are giving a certain medicine which has been by experience, which you know that it has cured hundreds of people, and you will also expect this patient to be cured, and you are only curing one system or one medicine which you think best, but whether it is applicable to everything or whether it is doing it right, we are not yet to be aware, because the scientific facts are there, scientific experiments are there, scientific evidences are there, but just think back how science was the greatest of the scientists who did the theory of evolution. When he travelled in the ship Beagle and he returned, when he published the theory of evolution, the world was not willing to accept the theory of evolution. It was not published. He lived in isolation. The greatest scientist of the world, who said the world is round and not flat as described in the books, he was laughed at, he was punished, he was kept away from the religion. One religious head who was anemic, who wanted to be given blood, originally was given blood by mouth, they thinking that this will cure him. The blood must be given by vein was only later. Your science is what pagutarivu, that is this common sense or this analytical knowledge, you analyze from the facts you have tried, and you correct yourself. Why Chandrayaan 2 failed? You overlooked certain facts. There is also science. Why Chandrayaan 3? You corrected certain facts. So there was science, some facts are missing. Now there is science, some facts are not. Some more facts are available, some facts are corrected. So science is also evolving, you should understand. Science evolves according to this. There is a faith, but the faith is a different thing, science is a different thing. You derive a common knowledge by putting these facts together, trying to understand and trying to cure the patient. So we doctors, I am speaking about allopathic medicine, we have to say there was a storm in the village, there was a village in which there was no malaria. People went and checked why there is malaria. The village had a pond. This pond water was a little, the tree was, cinchona trees were falling on it. The water was not drinkable, but they were drinking the water. It was not sweet, but they were drinking the water. It was containing, then they, from the water they extracted, from the tree bark they extracted cinchona, quinine was found. They found quinine is a drug for malaria. But all quinines will not cure malaria, and all malarias will not be cured by quinine. There may be a malaria which is not sensitive to quinine. So, but the original malaria, similarly, these people, these natives were using this curare dipped from a plant, from this one to kill the animal. The animal was paralyzed because of the curare poisoning. Then they found out what the poison was. Now they use it in anesthesia. So step by step we progress, from experience we progress, from the knowledge we progress, but the progress is for that time being. Future will prove you right or wrong, because we are also, science is also evolving, you should understand. We are trying to do our best. We are not gods, and I do not know whether you will accept it. We are trying to do our best to the patient. This you should understand, and any doctor who is worth, he will say, I am doing my level best to the patient, I cannot assure you the cure. When we explain to the patient that he is very bad, we are not able to do, we will do our best, then they will say, sir, we want a 10% cure. 10% cure nobody can give excepting on paper, and it will be a false promise. So I am surprised that when you want a cure, because we, in a photography studio they will write, we develop the films only you have taken. So when you give a poor negative, we will give a poor quality positive films only. So give a good negative, we will give a good positive. Thank you.